cardiology, we really cover a wide array of both plumbing-related problems, if you will, blockages, meaning stents and bypass, the illnesses that lead to those things, including diabetes, which more or less is managed by primary care, but we're still involved, high blood pressure, high cholesterol, and then as far as the electrical aspects of the heart. So we cover all the different arrhythmias, such as AFib and VTach and all these other unusual entities. A lot of times, the history that you get is going to help in a lot of ways determine what the problem is. And I think, unfortunately, in today's world, less and less time is being spent listening, and I think patients kind of feel like they're not being heard, you know. So I try to make myself available to them for that, and I think that they leave here feeling comfortable and confident, and that they were heard, and everything is explained to them in a very easy manner. It's not all this excessive medical language that a lot of people use, so layman's terms. I always pride myself on my listening. I know that in most times nowadays it seems like the appointment times are getting less and less. Fortunately, as a PA, that has not really happened as of yet, so I try to give them all of that 30 minutes in terms of that appointment. I tend not to rush. I tend to answer all their questions. In fact, that's how I conclude my visits with them. I always ask them, are there any questions that you had that I didn't answer, and or do you need any medications refilled, you know, things like that. So you try to make sure that you're an active listener to their problems. A lot of the people that I see in the hospital, I will likely see in the future in the office. So I get to see them when they're at their worst, if you will, and I also get to see them when they're doing better. And to me, that, you know, it just makes me feel good about the job that I'm doing, because I had a role in that person's getting better. So that's what keeps me going. And it doesn't matter when I was doing family practice or internal medicine, it was that same motivation, the same desire to just help people. My name's Tom Wolf. I'm a physician assistant. I work with Spectrum Health Cardiovascular within the Spectrum Health Medical Group.